Hi friends, I'm Astha Randev. I'm a senior psychologist working at Healthcare India. Healthcare India is an inpatient treatment facility working in the field of mental health for over 18 years now. We are going to be talking about stigma in mental health today, and we are very delighted to have Dr. Deepak Viheja with us, who is going to join me in understanding and talking about different aspects of stigma and why people feel so uncomfortable talking about mental health when it is so rampant and present in nearly every household in our country. Over to Dr. Viheja. Why do you think, sir, people are so uncomfortable talking about mental health issues?
Asa, as you've very rightly said, that there is some kind of a fear of being labeled, of being misunderstood, and then possibly trying to weave your life with that label of being a mentally ill. So over the years, and when I say years, I'm talking about decades of an unprecedented, unquantified effort by certain individuals to try and destigmatize and by establishing the scientific basis of the causation of these illnesses. Now, I hear very strongly about anti-psychiatry movement. I do not know a colleague who has to deal with an anti-cardiology movement. I do not know about an oncologist who has to deal with an anti-oncology movement. So there is a set of activists who want to prove that mental illness don't exist. And when we say mental illnesses don't exist, essentially what we are also trying to then establish is that mentally ill don't exist, and possibly the mentally ill feign the illness, or they are responsible for bringing it upon themselves, and to some extent they could possibly shrug their shoulders and not be mentally ill anymore. And I think this is as much of a discrimination, as much of a lack of empathy, as much as of a barbaric act towards an individual who is dealing with the dysphoria, the discomfort, the dissonance of the extreme mood instability, of feeling down in the dumps, for feeling helpless, hopeless, and full of regrets, to the extent that often people contemplate that life is not worth living and they contemplate to kill themselves. And to such an individual, if we try and treat them by saying they should only do yoga, or they should only just become a little bit more social, why don't they bathe, why don't they meet people, is, I think, an expression of extreme sensitivity. I'm not saying that maintaining a routine would not help a mentally ill, but in that frame, when you are feeling down in the dumps, when you are feeling so miserable that you do not have the strength to be able to get up and move around, and if you are given gyan and being told to do all of this, it feels like now you have hit the end of the tunnel. You can't call your employer to say that you're not coming to work because you're mentally ill, because not only he may not understand, it might just color your annual confidential report and it might just carry forever. You might just have to deal with that tag. So I think the issue of stigma is extremely complicated, and it can only be undone when there is strong advocacy. And we are living in times now where the resources we have are the best that we could have ever mustered. There are young psychiatrists, young mental health care professionals, young psychologists who are willing to fight for the rights, with the adage that do not do to another what you would not have done to yourself. So anybody could be a mentally ill. The fact that I am able today and I'm not disabled is a mere coincidence, it's a mere accident. Nobody brings about a mental illness on themselves. And if we were to go to understanding the scientific basis of the causation, then we are dealing with various factors, which include biological factors, the psychological factors, the social factors, and all of them have to be scientifically established so that we will ease the burden of the guilt that mental illness brings upon to an individual, that he is suffering with an illness in which he is possibly responsible for bringing it upon himself.